As with any major operation, recovering from hip replacement surgery is a crucial part of the process. Being informed about what to expect during this recovery period can help you prepare effectively and make your recovery as smooth as possible. In this video, I'll be going through the various stages of recovering from a hip operation. I'm Mr. Matthew G, Consultant Orthopaedic Surgeon at Shirley Oaks Hospital in Croydon, and I've been performing hip operations for over 15 years, so I'm well placed to help patients recover from their operations. It's important to remember that hip replacement recovery varies from person to person. The time it takes to recover depends on factors like your age, general fitness, and the reason for your surgery. However, while the specifics may differ, there are common stages in the recovery journey that most people will experience. I'll be giving you an overview of what this timeline typically looks like. Recovering in hospital. Immediately after your surgery, you'll be moved to a recovery room where you'll slowly come round from the anaesthetic. This is often a time when you might feel woozy or tired. You may also feel sick or even be sick, but don't worry, this is quite normal. Anti-sickness medication can be provided to help with this. When you wake up, you'll be positioned in such a way as to minimise pain and stiffness. Most patients are also given calf pumps to minimise the risk of blood clots. The typical hospital stay for a hip replacement patient is about 2 to 3 days. However, this can vary depending on individual circumstances. Pain management and comfort. After surgery, it's common to experience discomfort or pain in the hip area. This pain might even travel down to your knee, ankle or groin. Again, this is all normal and can be managed with painkillers, which will be provided by your healthcare team. You might also benefit from heat or ice therapy to soothe pain and reduce swelling. It's essential to keep your dressing dry to prevent infection. Your dressing will be removed about 14 days after surgery, usually during a follow-up appointment. Getting back on your feet. One of the key components of your recovery is mobility. A physiotherapist will encourage you to get out of bed and take your first steps, often on the same day as your surgery, depending on your pain levels, of course. Initially, you'll use a walking aid like crutches or a walking frame to move around. Getting up and moving as soon as possible is vital as it helps reduce the risk of blood clots, improves blood flow and speeds up your overall recovery. Preparing for discharge. Before you leave the hospital, your consultant will provide you with information about continuing your recovery at home. It's a good idea to have a friend or family member collect you, as you won't be able to drive. Alternatively, we can help arrange a taxi for your journey home. Although you'll be leaving the hospital, our support doesn't end there. We'll continue to check on your progress and you can reach out to us anytime if you have concerns or questions. By the time you go home, you should feel better than you did immediately post-surgery. However, your recovery is not complete. You'll need several weeks of rest and it will take time before you can return to your usual activities. During the first 6 weeks at home, it's important to follow some basic guidelines. Avoid crossing your legs. Don't bend your hip more than 90 degrees. Avoid sitting on low chairs or toilet seats. And be cautious with your movements to avoid twisting your hip. You should take any prescribed pain medication, even if you're not in pain at the time. And continue using a walking aid as needed. Follow the exercise program provided by your physiotherapist and attend all scheduled follow-up appointments. Recovery from hip replacement surgery can take 6 to 12 months. By 6 weeks, most people can walk unaided, drive, and even return to work, depending on their job type. High-impact activities like contact sports should be avoided until you're given the go-ahead by your consultant. Sexual activity is usually safe to resume 6 to 8 weeks after surgery. It's normal for recovery to take time, so be patient with yourself. If you follow the advice and guidance provided by your healthcare team, you'll be back to enjoying the activities you love before you know it. Remember, whether it's about managing pain, the best exercises for your recovery, or adjusting to your new hip, we're here to support you every step of the way. So that's a brief guide to recovering from hip surgery. If you have any more questions, feel free to leave them in the comments section below. If you'd like to arrange a consultation with me or another consultant in your local area, you can give us a call or go to circlehealthgroup.co.uk.